few weeks' time. So we plan to have a bi-monthly lecture series on immunology and inflammation. Today's series in the basic immunology, and there is other courses will be in that bi-monthly lecture series. Will be in that second course will be on innate immune response inflammation in April and May. Third will be adaptive immune response inflammation in June 2021 and July 2021. Fourth is the inflammation and autoimmune diseases, August, September. And fifth is the inflammation and metabolic diseases in October and November. And sixth and last is the inflammation regulation and therapeutic implications in December. As you know, there is a great feast on knowledge about inflammation, which will be dealt by the top-notch expert in the field, not only from the country as well as from the abroad, all over the world. So with these words, I like to invite Dr. Manjula, that Vice President of Microlab, to say a few words.
Thank you very much, sir. Good evening to everyone. It takes me great pleasure to welcome you all to this very, very special session, Inflammation and Immunology. I from Microlabs. Microlab is a multifaceted healthcare organization. It manufactures and markets pharmaceutical formulation as well India as well as globally. And also we are involved in the lot of research activity as well as educational activity under the aegis of Micro Knowledge Academy. And this is one such activity. I thank Dr. Chandrashekara sir and the Society of Inflammation Research for giving us this opportunity to partner, making us a scientific partner in this initiative. Very, very wonderful initiative. I assure you that from our side, it reaches as many doctors as possible across India, even other parts of the world, so that they gain from all the expert knowledge which will be shared across this series over 1 year. Thank you so much for this opportunity. Over to you, Professor Biswar, sir.
I welcome Dr. Padma Shastri, retired principal scientific scientist from the NCCS Pune. He is the co-chair, and we will have the 4 talks today. Each talk is 25 minutes, followed by each lecture is 25 minutes, followed by 5 minutes discussion. Our first speaker is our secretary, Honorary Secretary Dr. Chandrashekara, and the consultant rheumatologist CRICR Bangalore, Chandra Center of the Immunology. And may I have his first slide to introduce? Dr. Basan.
Mr. Iyengar, can you share the file?
Yes, Doctor. Yes.
Although he doesn't need any introduction to the community of immunologists and rheumatologists, but still we like to say a few words about it. Dr. Chandrashekara S, MD, DNB, DM, is the medical director of Chandra Rheumatology and Immunology Center and Research from Bangalore. He is the vice president of Indian Rheumatology Association since 2019 and president of the Indian Rheumatology Association Karnataka chapter in 2019. He is the general secretary of our Society of Inflammation Research from 2016 and managing trustee of the Immunology and Arthritic Research Educational Trust, executive director of the Chandra Journals, faculty and program coordinator of the post-MD fellowships in immunology and rheumatology in CRICR. He had got many awards. 2015, she got Sir C.V. Raman State Award for Young Scientists. That's the medical sciences from the government of Karnataka, State Council of Science and Technology for the year 2013. 2019, he got the IMA Pune annual NIO Oration Award, IMA Maharashtra State. Then 2013, he has got the Oration Award of Indian Rheumatology Association. 2000 is Dr. Malaka Reddy Oration Award. He had more than 100 publications, and his special interest is autoimmune disease, recurrent pregnancy loss, and in silico modeling. He's a very nice human being, a very good organizer, and as the secretary of our Society of Inflammation Research. Over to Dr. Chandrashekara for your talk on overview of the immune system, organization, and linked diseases.
Thank you, Professor
Dr.
Biswas,
Chandrashekara.
for nice words. I hope I deserve all the prizes that you're given. I think I'm not very sure, but we will try my best to deliver what best I can do. I think I will share my slides. Yeah, I think in next 20 to 25 minutes, I will be just moving through going through about how immune system is organized, and overall try to make one to understand the complexity that it has developed with a lot of principles and the methods and the way it has got itself organized to be a perfect system with a lot of imperfections. I will tell you what are the issues that we are really going to dissect out, knowing about how the immune system gets.
Can I have your slide?
The slide is.
You have to go for slide share.
You have a slide
Yes.
show.
Slide share.
Oh, okay.
Please go for slide share.
I think.
So your desktop is seeing.
I
Yeah,
think go back, I think, sir, otherwise it gets
yeah, I
deleted.
think there is some issue. Okay.
Yeah, now it's comes.
Now it's
No,
Now
no,
yes,
it's.
you are audible
Yeah.
and seen.
Oh, fine. Thank you. I think. Sorry for the glitches. Yeah. In a nutshell, why do we have immune system? I think most of us are clear. We need a system with an intention to defend our body. We have a lot of systems which are put in place for us to defend ourselves. Though we don't love philosophically to compete each other, but the nature that hasn't left us without that. All of us, including from the microorganism to the virus to the more complex human system, has to compete each other to survive. And it works on a simple principle of survival of the fittest. And in this war of survival, we need to counter, we need to combat, we need to fight with many of the organisms which tend to invade and try to cause harm or injury to us. So in a nutshell, we need to arm ourselves. We need to fight and defend our own tissues and our own organizations. So that being the case, we have multiple levels of defense that has been put in place, which we otherwise put together, we call it as immune system. As all of us know, the first line of defense is an integrated, well-maintained epithelial or endothelial tissues, which could be skin, mucosal surface, or we can also have a defense against varieties of pathogens which come. It could be inside cells, which can kill the infected cells, or it could be a systemic infections when there is a killer, the bacteria, fungi which lie outside. And any immune response will have two different phases of responses, as all of us know about it. First, it handles the acute infections, wherein it tries to block the infection entering in, where it tries to avoid the spread of these infections. And it is a transient acute phase of response to the scenarios, followed by a system which it brings in to prevent a future infection. So in a nutshell, immune response is organized to defend the body. It defends the cells inside. It defends the entire system. It handles a scenario immediate and also tries to figure out how exactly we need to work it out further. In future, when it happens, how we should avoid this infection happening again. So immune system, though evolved over a period of time, or we think it has a main process as a defense, we also started realizing it's a system which works for homeostasis. It's a system which has a lot of regulatory functions and regulatory activities. So immune system by definition, though was evolved or developed for the sake of a defense, it also developed over a period of time to maintain a balance or a homeostasis, and also developed a lot of regulatory functions. In addition to that, if we look in depth, that we do see that some of the regulatory functions are either it has been picked up by other system to influence the immune system, or the immune system influence the other system for sake of defense. For example, the corticosteroids are secreted, which in turn either dampens or tries to augment or attenuate the immune response so that the harm is reduced, or it shuts down the immune response, which is otherwise not wanted. Similarly, the regulatory secretions of immune system like TNF-alpha, interleukin-6, interleukin-2, they have a influences variety of metabolic processes. Thereby, they augment or alter the metabolic processes either to facilitate a defense or to alter an immune response. So there is a lot of regulatory functions which has been either taken up or imbibed by the immune system or has been done for regulating the immune system response. So thereby, the immune system over a period of time from just being a defense also has developed a lot of role in maintaining homeostasis, also has evolved into have a lot of regulatory functions. So that being the case, the immune system has been moved hierarchically into a super system. In a organization of the human, we divide the system into a super system and a subservient system. There are three super systems, which are immune system, neurological system, and endocrinal system. Any of the stress, any of the invasion, any of the injuries or anything which happens to the host, usually the three systems respond in a coordinated manner. The neurological... Hello? Am I audible? Yeah. The neurological system and the hello? Neurological system senses the injury or insult that has happened, and in turn stimulates the endocrinal as well as immune system. Simultaneously, the secretions of immune system influences the neurological function, so also stimulate the endocrinal system. So there is a communication between the three super system, alters and augment varieties of functions of the subservient system like gastrointestinal, hematological, and various other organ systems to finally come out of the distress or come out of the insult, injury, infection, whatever is the changes that has disturbed the homeostasis. So that being the things, organizationally, immune system is considered as one of the part and parcel of the super system which regulates or imposes or maintains and manages homeostasis. So to achieve this, the immune system by its structure and organizations has been divided. This is basically, it is an artificial division that what for our understanding, we have done it into an innate immune response as well as an adaptive immune response. Innate immune response, as I said in the very beginning, we have an immediate action that is required when there is a infection or when there is an injury. This needs to be rapid. It should halt or alter or reduce the impact of the insult that has happened. But usually these kind of acute responses don't translate into a memory. Whereas An adaptive immune response, it is slower. It usually takes a couple of days to months. It slowly tries to clear the infections and keep it back in the memory so that when a second infection occurs, it tries to respond quickly, or it tries to prevent the second infection happening at all. So in a nutshell, we have two artificially divided. Why I say it's artificially, because they run one on another, but certainly one is a rapid action force which comes quickly, tries to halt and do the job as early as possible. Then slowly it hands it over to the adaptive immune response. It's not that it completely hands over, it continues to play a part despite adaptive immune response being effective or being active. So the components of immune systems are the cells. I think our next speaker is going to speak in detail about the cells which are responsible in varieties of immune response. In that, we have cells which are useful in innate response. There are cells which are useful in adaptive immune response. Most of the adaptive immune response are taken over by lymphocytes. And organizationally, we have a different structural organizations. We have a primary lymphoid organs or a primary immune system organs. We have a secondary lymphoid organs. And also we have circulating system, the blood and its components, especially most of the white cells, even including platelets, do play a proactive role in immune system functioning. Lymphatic system through which the lymph moves and migrates across. And we have several proteins and their products, which all become a component of this complex immune system, which is all pervasive and which is present in the human system from almost in every other parts. So when it comes to the responses, as I said, in an innate response, most of the response, as I said, is a non-specific response. This includes in exterior barriers. These are intrinsic and they are always there, and they are not situation dependent. They are usually stable in a sense. They don't change depending on the requirement unless it is being breached, cut, or anything has happened. Otherwise, they remain stable. They don't change much too depending on the circumstances. The best example are skin, mucous membrane, secretions which are associated with them. So usually barring the secretion, whose quantity may increase or decrease depending upon the infection or any stimuli, most of these structures remain as they are. They are not recruited or altered depending on the circumstances and situations. These are one of the major component of innate immune response. The second component of innate immune response are responsive system. What we meant here is these changes its compositions and recruits and amplifies depending on the stimuli. What I meant here is, for example, the number of neutrophils, the number of lymphocytes, number of macrophages that are required at the site of infection, site of injury, depends on the quantum of injury, and it gets recruited based on the stimuli. It multiplies in numbers and it also alters its functional capability depending upon the stimuli. Either they may rupture, they may gulp in the bacteria, they may opsonize the bacteria. Varieties of function occurs, which occurs as a response to a stimuli, and it is changeable. It changes in its compositions, and it also gets into a different compositions and ratios and proportions depending on the stimulus. This is a responsive system. It is an innate component of the system, predominantly made by the cells and the proteins. They are usually not completely organized, but in some areas, they are either pre-organized with sort of a non-specific assembly, and or they may keep circulating across the tissues in a time-bound manner, so that whenever they get to the stimuli, they either station there or gives the signals for further amplification. So these organizations either could be called it as evolutionary rearrangements or situation or individualized rearrangements. To give you a simple clinical example, the evolutionary rearrangement is something what has happened over a period of time, depending on the evolution process. For example, most of us exposed to a good number of antigens. As a result, through the mouth, or there is a possibility of infection, etc. As a result of which, around the oral cavity, to guard the oral cavity entry, we have a well-organized lymphoid structures, what we call as internal Waldeyer ring and external Waldeyer rings. This is a pre-organized lymphoid tissue, pre-organized tissues which have come over the process of evolution. Satiation are individualized rearrangements. For example, person who goes exposed to a repeated smoke or repeated external pollutions, his mucosal membrane becomes slowly and partially inflamed, keep the number of cells in a little more higher than a person who is never exposed to these insults or injuries, with an intention of a preparedness for infections or injuries. So either based on the satiation or an individualized threat and exposure, these system responds. But to remind again, this is not a memory dependent. This is the moment the constant influence, etc. goes off, they may disappear or reduce. These are what we call as satiation or individualized rearrangement of the responsive system, or an evolutionary based rearrangement. The evolutionary based rearrangement is permanent, whereas satiation or individual based rearrangement is partial and could recede once the cause for it is withdrawn. So this is how the cells make through an innate immune response. When the microbe enters, first it faces epithelial barriers, then the phagocytes and neutrophils take them up, complements in additional natural killer cells. These moves it across to present it to the adaptive immune system, which over a period of time, over 3 to 5 days, gets the response of either antibody and T cells. So that's how a system has organized itself to respond acute as well as slowly over a period of time to fight the external agents which could otherwise cause or disturb homeostasis or cause insult or injury to the host. So the question that comes for anyone, including we as a clinician, is why should I know the organization? What's a big advantage? I know how the immune system are recruited, how the immune system responds. But if we really know, if we know how the immune systems are composed, because as we know, we are composed by many cells, an anatomical arrangements of the immune system is thus arranged, I will go in the next subsequent slide, to facilitate an interaction between an antigen and the cell at an appropriate time. So if we know these basics, if we understand these basics, when we plan any interference, any intervention, any treatment, at that point of time, these information will come in handy. So we need to understand the entire structural organizations, how an immune system reacts when an antigen enters from the skin, when an antigen enters through the gut, when an antigen enters through the mucosal membrane. So in the organizations, as I said, in the organizations, we have central lymphoid organs as well as secondary lymphoid organs. The central lymphoid organs are bone marrow and thymus, and secondary lymphoid organs are spleen, lymph nodes, which includes adenoids, and we have something what is called as mucosa-associated lymphoid tissues, skin-associated lymphoid tissues, as well as of late we are realizing that there are some segregates of these lymphoid tissue in different tissues which are differentially organized for a specific purpose. So we have a central lymphoid organs, which is bone marrow and thymus. We have a peripheral or a secondary lymphoid organs. What is the primary function of central organs? It is a producer, it trains, and it also looks for quality assurance. These are the three fundamental jobs the central organs like thymus and bone marrow does. So how do they differ? The thymus is the source for T cells, and the thymus has a very stringent selections. I think when we talk on the tolerance selections, negative and positive selections, we will be understanding about the stringent selections, and these involutes with age. As the age progresses, the size of the thymus, role of the thymus starts coming down. The bone marrow is the source of B cells. Currently, we believe the selection of B cells are not as stringent compared to the thymus, and they do not completely involute. However, production rate regresses with the progression of the time. That's one of the things what we call as senescence of the immune system, which happens with the gradual reduction in the possible B cell production as well as possible reduction in T cell productions. So this is some point where the quantum of repertoire, the possible repertoires that are available for immune response slowly comes down. So this is how the central organized lymphoid or immune tissues performs. They mainly produce, they select, they train, and they release the cells for its interaction with the antigens. So this is how the things work. The T cells and B cells, they come out and they slowly settles up into an organizational structure in the secondary lymphoid organs, which include, as I said, tonsil, lymph node, spleen, malt, and gall. And the distribution to these lymphoid organs have a structural pattern. It's not that they randomly go and sit there. So they are arranged in such a manner so that they proactively interact with the antigen presenting cells. And in their arrangements, we have various arrangements that we see: a diffuse infiltration, perivascular infiltration, subcuticular infiltrations, or they may organize themselves into the lymphoid follicles, germinal centers where the center proliferates, multiplies, interacts with varieties of antigen presenting cells in the presence of T cells and other supportive cells, including endothelial cells. And they are structurally organized in such a manner, in a nice assembled manner, so that in a real time, they expose themselves to the antigen to react more appropriately. So it's not that they randomly sits there, they randomly settle there, and they interact with the antigens in a random manner. There is a schema which has been brought in over the process of evolution, that there is a sort of organizational structure which has developed in the secondary lymphoid organs to organize a nice exposure of an external antigen to the secondary or an adaptive immune response to develop a good immune response and a well-recognized and a pattern immune responses. So as I said, in the evolution, the organizations is you can see the internal Valdeir rings with an adequate external Valdeir rings. It almost guards the entry of the possible antigens, possible bacteria, and possible other materials which could otherwise swallow in a need of continuation of the survival. For a continuation of survival, eating is a necessity. When you eat, we expose ourselves to the lot of proteins which are otherwise could be antigenic. At the same time, we are likely to get exposed to varieties of infective organisms and varieties of other things which could cause or harm. So you could see a guard sitting across as a lymphoid structure with both primary and secondary. This is an evolutionary arrangement that has been made. And as I said, this is usually permanent, and it could go for hypertrophy or it could shrink depending upon the necessities. So one need to remember that the immune system has developed and has an orderly arrangement to coat an antigen. The entire of this structure, if you can see, it has been made in such a manner and it's arranged in such a manner to coat an antigens. So an exact stepwise interaction is often determined by the port of entry. That's from where the antigen enters, whether it comes from the skin, whether it comes from the mucous membrane, whether it comes from the gut, whether it is picked up by a dendritic cell and passed on, whether it's picked up by a neutrophil and passed on. So in addition to the status of the system, the way how it enters, how anatomically enters make a difference. To give a best example, we often see that an antigen which enters through the oral route, through the mucous membrane, could be tolerogenic. We exploit this particular tolerogenic mechanism in what we call as development of tolerance or desensitization. We use both in allergies therapies. We try to use in autoimmune disease using the myelin basic proteins, collagens, to generate a sort of tolerogenic response, which could give a long-lasting tolerance to autoantigens or allergic immune response. So to understand this, we need to understand the way the immune system has organized. So it is just not that they are just randomly sits into the secondary organs or secondary lymphoid organs. They have a specific arrangement through which they have organized themselves. In addition to that, by knowing the intactness of the structural organizations, we can also interpret some of the histopathological and some of the observations that we make. For instance, if there is a distortion of the arrangement or an organization that would be there in lymph node, if it is observed under microscope that that's not is intact, that it suggests that probably it is not a response to a reaction that is happening outside. It is something which is really happening in the lymph nodes. For example, if there is a tuberculosis infecting the lymph nodes, there will be a total distortion of these arrangements. In a reactive adenitis, when there is only a proliferation or amplification of this particular structure because of the excess of demand, at that time, usually they tend to maintain the organizational structure. So if you remember and know the organizational structure of the system, of the immune system, both primary and secondary, we will be able to interpret the pathological process that is happening. So when we do sometime in vitro and when we switch it to in vivo, actually sometimes we find a significant difference. So for example, in vitro, we thought inhibiting or blocking the TNF is going to make a wonderful outcome with reference to rheumatoid arthritis, but we failed when we really put it into a clinical trial. The reason is when we do in vitro, we are unable to establish an hierarchical interface. We are also unable to completely replicate the internal milieu of the host, and also interaction with other systems like endocrinal and neurological. As I said, it's a super system. It interacts with each other. That cannot be duplicated when we do it in vitro model. That's where from in vitro translation to in vivo translation, sometime what we expect may not be happening. So this is here is the way your understanding of the structural responsiveness, organizational responsiveness of the immune system is going to help us in interpreting those data and informations. So to be brief, I mean, in a nutshell, immune response is a process. It responds in a very structured and organized manner to look at the flow. If there is a danger signal, either because of pathogenic organism or an injury and a release of debris, it is sensed by the innate system through TLR and other signals. I think the details of which will be discussed gradually. And in turn, it interacts with resident cells, stimuli, a lot of signals, varieties of immune competent cells. When they are sensed by the innate response, it mobilizes immune competent cells, extravasation of the cells into the structures, and there is migration into the site of inflammation. They all continue to have an interaction of the cells, and cells are activated, differentiated, proliferates depending on the milieu of cytokines and other tissue factor, which in turn influence the process. It activates the adaptive and inflammatory and immune competent cells. Finally, with an intention to initiate the clearance of the offending agents or initiate the clearance of the injury or other damage that has happened. Finally, it brings down over a period of time to go for a resolution of the process. Immune system do play a part in the resolution system. What starts up as a danger signal response finally ends up in initiation of resolution. And in this entire process, a perfect balance is required. As I said, just to give an example, Treg in excess can allow the pathogen expansion. T cells in reduction or a loss of functions may eliminate pathogen, but results in immunopathology. A perfect balance is something which resolves the things without causing much impact or damage to the host. I think this we have learned in the COVID era, where we could see the cytokine storm, wherein there is a dysregulated immune response, or where there is inadequate response, patient may be affected by the virus invasions. So with a quick overview, I would like to conclude that the immune system is one of the highly developed, well-developed super system, which has a fantastic organizational structures. And we have yet to understand the need, necessity, and the principle on which these arrangements or organization has happened. As our learning is increasing and improving, we are able to treat and manage these patients in a much safer and much better manner. Thank you very much for patience hearing.
Thank you, Dr. Chandrashekara. It's a very elegant talk. and you have given a very nice overview of immune system, organization, and linked diseases. And this will act as a good backdrop for other speakers for the cells of the immune system and the disease rate with the functions, immunoglobulins, complement systems. And I just want to know that whether there is any questions from the Basant, if is question for you. We have got you have taken. We have got few minutes time, 5-10 minutes. We can discuss some of the questions.
As of now, no questions, doctor.
No questions.
No questions. Maybe down the line it will come.
Any of the speakers has got the questions? Other speakers. How is the inflammation works in the COVID system? COVID diseases, COVID-19 diseases, inflammation, is that play a role?
Yeah, the inflammation, as I said, plays a critical role in fighting against or trying to clear the pathogens. As I was saying in that flow, suppose if the immune system identifies at the very entry point, responds adequately, clearance can occur without even disturbing the host. That's what we call as asymptomatic hosts.
COVID.
If the infection load increases and the inflammation response increases to the increased infections, that's a point when the regulation of the cytokine production, the regulation of the inflammation response may go off. And at that point of time, we get into a dysregulated inflammatory response or a cytokine storm, what we otherwise term it. At that point of time, the inflammation spread across, causing the damage to the host tissue. And that itself, we see in majority of the patients losing the patients, because that can cause a severe damage, sepsis, and a gradual collapse of the multiple organs.
Any questions from the audience or any of the speakers or panelists? So we'll go to that.